Hi, this is Michelle Walker. We're going to be doing a NG tube placement today, and we're going to first check the orders of the patient and verify the allergies. We're going to assemble equipment and assess the patient, and we're going to wash your hands and identify yourself to the patient, as well as identify the patient with 2 identifiers. You're going to provide for privacy, and then you're going to explain, evaluate, and educate your patient. And for this focus assessment, we're going to do the abdomen. You're going to first have them down in supine position. You're going to assess for abdomen distension. You're not going to do the procedure if you do find that. You're going to assess the bowel sounds and palpate. After that, you're also going to want to ask them about their bowel movements and last output of urine. And then you want to place them in a high Fowler's position. Semi-Fowler's is also acceptable, but at least they're 30 to 45 degrees up. And you want to ask them before you start the procedure about any nasal surgeries, any nosebleeds, deviated septum, any problems that would interfere with this procedure. You want to test for their cough, so have them cough a couple times. You want to assess their gag reflex with a tongue depressor or a cotton applicator, and then you also want to assess their nasal patency by doing the Nair check on each nostril. And you want to insert the NG tube through the most patent nostril. And you're going to have some just regular water, some saline water that you're going to test your tubing for patency first. And you have your lubrication out. That's going to lubricate the tip of your NG tube before you insert it. The patient is going to tilt their head back first. You would go ahead and gather. Then I would assess any stomach contents that come out for color. So pretend I have my lubrication out here. Coffee ground, anything like that. You would squeeze the lubricant out. You would take your NG tube after you confirm placement or patency of it. Get lubrication on there. So then once I'm done sectioning, I would, and then you would go ahead and ask the patient to tilt their head back slightly, and you would have an assistant help you also for assisting with water sips. You would insert slowly until you reach the back of the throat.
You may want to cut the video where you say...
I'm sorry, before you do all this, I'm so sorry. You're going to measure. Very important, before you do all this, you're going to measure from the tip of the nose to the tip of the ear, and then all the way down to the xiphoid process. So that tells you where it's actually going to be placed in the stomach. You're going to mark it with either a marker or a piece of tape, so you know where your marking is. Then, after you have that all measured, then you would go through the nose with their head tilted back and slowly insert. And then, once you're at the back of the throat, make sure it's not coiled up back there. Then you would have them slightly tilt their head forward and begin sipping their water. And then you would just push it all the way down until you reached your tape up here. And once it's all the way down there, then you can take your bulb.
No.
You can take your bulb and test for residual, and you got some return. And then you would, to confirm actual placement, you would get an x-ray. But I'm going to get out here. I'm going to anchor with a piece of tape before she goes in, has an x-ray done, just to keep it placed. We're going to anchor it right to the nose here. confirm placement with an x-ray, and then you're able to anchor it to the gown after you confirm placement, and then you would hook your suction up to the wall and turn it on low intermittent suction. You would then assess your contents that are being suctioned from the stomach. You would note the color, amount, and consistency of it as well. And that is it. You want to document everything in the chart and how the patient tolerated it, as well as your measurements and confirmed placement and your residual that you document.